So just to continue, question 1, what is the goal of using a client history assessment tool to gather data about nutrition, exercise, leisure, activities, spirituality, and home environment? Many of things that we've already talked about. And in this case, we think about, well, part of our reason for gathering assessment is for, being able to develop a plan of care. That's the normal response. Or, some people think it's to gather data because we have to put all this stuff in the computer, so we meet insurers or regulatory agencies. Obviously, it's not to assist the physician in developing a medical diagnosis. We do want to gather data about the causes of the client's illness because that does help us with planning. But the best answer here is to increase the client's awareness of lifestyle choices and his or her role in wellness. So when you and I bring this question to you because if you were being asked this question in terms of another subject, you might not think of it this way. You would probably think C is really the right answer. But when you're talking about health promotion, not like what we do in terms of acute care in the hospital and planning, but health promotion planning, the goal is asking a lot of these questions are, at the same time we're gathering data, we're helping that client be more and more aware of their choices and how those things are impacting their overall health, so that they can make connections about that. And then with us gathering that information, it helps us kind of work with them and help them identify things that they can put in place as interventions, not interventions as much that we plan for them. So we're trying to move away from in the hospital setting where we are being the ones to help develop maybe some plans with them for improvement or recovery. Here, when you talk about health promotion, the goal is very different in terms of how you're doing your planning is really supposed to be inspiring them to improve and figure out, new ways of managing their health. So here, this is a good example. The focus of health promotion is very different. In acute care, we would have patients that have blood pressure of 150/88, and they're on blood pressure medications probably daily anyway. But they'll have a PRN order in there for us to give hydralazine, which is a drug for blood pressure that we give intravenously for quickly bringing the blood pressure down. And so that PRN order may say that we don't even give that unless they're, over 180 or over 90. Whereas if you were to take a blood pressure of a patient at a health promotion clinic, if their blood pressure was 130/82, we would go ahead and refer them for evaluation of their blood pressure with their primary care provider. Because the new standards for hypertension are that really anything over 120 or over 80 should be followed up from a prevention or a promotion to kind of keep that from ever getting as high as 150/88, so that they may need to be on some kind of medical management much earlier than what we have done before. So just be thinking, if you see health promotion in terms of, things that you're doing in next semester in community health or those kind of things, you're going to really change your mindset over to, I've got to know as early as possible that somebody might potentially have a health abnormality so that we can get on the front end of this thing and help them really control this, lose weight, do whatever they need to do to manage potential illnesses and diseases before they occur. So just try to keep that straight in your mind in terms of those kind of things. So our role as a nurse is to support and facilitate change. It's not for us to prescribe exactly what a client needs to do, should do. It's not an authoritarian approach at all. It has to be based on being a kind of a guide by the side and a coach, more so than being a person that's kind of taking things by the hand and doing them for people. In the hospital, people may be weak and we have to do things for them to supplement them, and then at some point we try to start getting them to do a little more for themselves. But they may even go home and be discharged and still have some dependence on others. Whereas when you're talking about health promotion, the goal is really trying to help patients recognize and develop kind of their own strategies. And if we do it all for them, they're never going to self-manage their disease or their conditions or the health concerns they may have. So, using the nursing process to promote health, you're going to assess patients, but you're going to analyze the assessment data to describe related causal factors and have the patients or the clients really think about what are the causes of some of these disease conditions. What things can I do? And so when you come to planning, it's a very joint process, not just a nurse-driven thing, where you have to kind of help the patient envision acceptable outcomes. And most of the time, you really want to set very small, realistic goals, sometimes that need to be, do a little something, have success in that, kind of in a stepwise fashion. Now we'll move the bar up a little bit more. And so and that is a rewarding thing, like I made it. If you say to somebody, you've got to lose 150 pounds, that looks like a mountain that they will never accomplish. So trying to do it in increments, or trying to learn some skills for health promotion in increments, and is something realistically that they agree to and want to accomplish, you're going to have much more success with patients trying to promote and improve their health. So we have to assist the patient and the family to recognize what strengths do they have, what creative abilities do they have, so that you can really inspire them to self-management. And it's more of a, let me help, comment on things that I see that you're strong in, and that kind of builds their self-confidence so that they can kind of move towards self-management of their disease. And then I would like to end with, promoting health of self. Nurses are not the healthiest people, to be honest. That's really kind of an oxymoron. But the truth is, you ask, what is the health of our professionals within our discipline? And, that is a understudied area in terms of research. As a newer clinician, most of you guys have can have some health concerns, but you're fairly young and you may be fairly healthy and fit. But you think about the work environment that we've talked about before, how hard it is to do this work, how much stress is working long shifts, multiple demands, things don't go right. Are we finding ways to keep nurses healthy and have safety on the job, and so that we retain nurses in the profession and ones that are going to be healthy enough to work for many years in those kinds of jobs. And so the other piece of that is we can be having clients that are looking at us like, this nurse is overweight, she doesn't seem like she's too healthy in the things that she's doing, but yet I'm supposed to listen to her about how to eat right. So I would express to you that probably for the health of the profession in the future, we really need to examine how well are we role models for health for our clients. You can have people who are like a fitness trainer, and they're usually really fit, and they don't overeat, they don't have unhealthy behaviors that are interfering with them being a role model for their patients. So within the nursing profession, there needs to be somewhat of a movement, I feel like, to make our work environments safer, support our mental health, as well as our physical health, so that we can be strong enough to care for people in general, but also because we're going to have more impact with our clients if they can see that we espouse healthy practices, and we're able to manage it even with the kinds of workload and things that we're doing. Then that sales job in terms of being the coach at the side or the cheerleader is going to be accepted much better, and clients may say, well, you've been able to do this, and maybe I can do it too. So just food for thought, and that's all I've got for this one. Thanks.